Hello. Today I'm going to be talking about vowel intervention. My name is Michaela Hickey. What is vowel intervention? Vowel intervention is an approach that targets vowel production in children with speech sound disorders. According to Spake et al., vowel difficulties occur less frequently than those with consonants, but may have significant impact on intelligibility. Some notable researchers are Fiona Gibbon and Karen Pollock. Types of disorders associated with vowels are childhood apraxia and childhood dysarthria. So when should clinicians use this approach? This approach is important to use when children have speech motor planning disorders. So apraxia and dysarthria, both of those are have difficulties with motor planning. Vowels are established by the age of 3 in normal developing children. And children typically have moderate, severe, or profound phonological impairments when this intervention is used the most. It is critical that clinicians know how to correctly teach vowel placement. So, vowel target intervention. So, research has been shown that when clinicians work on vowels specifically with a child, it instills a metacognitive framework on how vowels should be produced. Vowels may be worked on with consonants, and a lot of the time can improve intelligibility. But if a child has a profound speech disorder, they may need that extra vowel therapy. And then some approaches that can be used in therapy is DTTC, which is dynamic, temporal, and tactile cueing. This is just a treatment approach that relies on the clinician to guide a client through a hierarchy of motor-based cues to achieve accuracy in target vowels. And then Bjorn cards are just speech sound cue cards that are used in therapy. They just have little pictures on them, and it's just easier for children to understand kind of the placement of where their vowels should be. So I have a video of a clinician showing the technique using Bjorn cards. So I'm just going to play a little bit of it for you guys.
The segmentation. Ready? Open your mouth first. Nice thinking. Okay, watch me. We're going to do it together first. Watch me together. You got to watch me. Eyes on me. That's it. Yay. There's one.
Okay, so as you can see in this video, I know that it's not a very good view of the clinician, but you get the point of what she's trying to accomplish here. The boy can see that whenever he says the phony vowel, he is supposed to have his mouth open. And so on the picture, it shows you what you're supposed to have your mouth, how you're supposed to have your mouth. And then there's a link if you guys wanted to go there too. So some strengths and weaknesses are that strengths, direct therapy for vowels can have positive outcomes, and then there's a remarkably wide selection of approaches available. Weaknesses would be that vowel therapy is elusive, frustrating, and often appears to be avoided, which is what was said by Fiona Gibbon in the book. And then only small numbers of cases that show it works, and SLP's own vowel production skills are vital, which I had said that previously, talking about how it is really important as clinicians, if we are going to use this approach, we do need to be educated on all that goes into vowels, the long vowels, short vowels, diphthongs. There's just a variety of motor planning that goes into that, and we should definitely be aware of what those are and how to incorporate those. SLPs can use this approach in severe cases if you as a clinician feel as if this approach is needed in your work. Then it can only help the child improve. Yes, you can see that for weaknesses, there's only a small number of cases that show that specifically working on vowels works. So yes, it will work using it, and it can improve, but I believe I'm going based off school-based too. I work in a school. I've been working in there for this. I'm going on my 4th year, and I've never been introduced to it, so I feel like this is more of a medical-based practice. But I hope, and then these are my references. So I hope you guys have a better understanding of what vowel therapy is.